Good morning, everyone, and thank you for coming. I'm Rebecca Rohn, Director of the Coulter Translational Partnership Program at the University of Missouri. We're here today to celebrate the annual selection of the Coulter Program's Translational Research Awards. These research awards are designed to give promising medical discoveries a final boost in funding to help them succeed in the step from laboratory research to commercial investment. At the University of Missouri, our faculty members conduct groundbreaking research into health conditions such as cancer and heart disease, which affect millions. Many of these discoveries hold great potential to improve the lives of people throughout the world. However, these research projects often require a final bit of investment to demonstrate their technical feasibility and their potential to help patients and society. Today's grant announcements mark the second year of Coulter Program grants, and they represent the efforts of many people. I would like to recognize MU Chancellor Brady Deaton, MU Vice Chancellor Rob Duncan, Dean of the MU College of Engineering Jim Thompson, Interim Dean of the MU School of Medicine, Les Hall. Co-PIs on the Coulter program, Dr. Jerry Parker, Associate Dean for the Research of MU School of Medicine. Chris Fender, Director of MU's Office of Technology Management, Industry Relations. And Jinglu Tan, Chair of the MU Department of Biological Engineering, who unfortunately couldn't be here today. I'd also like to thank Dr. Jamal Ipta and Dr. Jerry Parker, co-directors of the MU Institute for Clinical and Translational Science. Next, I'd like to introduce to you MU Chancellor Brady Deaton.
Rebecca, thank you very much, and a good morning to everyone. A beautiful day for a very, very significant announcement on the part of the University of Missouri, and really a celebration of the ongoing success we're having with the Coulter Translational Partnership Program. We're very excited about this program, as I think you will see here as we go forward. The University of Missouri is one of 15 elite universities in the nation to be in partnership with the Wallace H. Coulter Foundation. Of course, we're the only university in Missouri with this distinguished honor. And it's a testimony, the existence of this partnership is a testimony to both the breadth and depth of quality research and scholarship and efforts to commercialize intellectual property that is now occurring on this campus. We're one of the few universities in the nation, actually I believe it's fair to say the only university in the nation, with a College of Medicine, Engineering, Nursing, Health Professions, Veterinary Medicine, Agriculture, Business, and an academic medical center on one campus. There are only, I believe, 6 universities in the nation that can even come close to bringing that group together. So we're well positioned for translational research, taking research discoveries in the laboratory, transforming them into ways that and methods that benefit health people in general through health products and services to the health of human beings. Our goal is to improve the life of patients through the scholarship that we undertake here at the university in fulfillment of that land-grant mission that is so important to us. So the Coulter program is really a testament to this interdisciplinary collaboration, and you're going to see that in a very major way when we make the announcements here in just a moment of this year's awards. Every project that we're talking about today is led by faculty members in the MU School of Medicine as well as the College of Engineering. And to tell you more about those collaborations and to give you more insight into this program, I'm pleased to recognize and bring forward the Vice Chancellor for Research at our university, Dr. Rob Duncan. Rob.
Thank you, Chancellor. Appreciate it. Thank you very much, Chancellor Deaton, and thank you all for being here for this exciting celebration today. I would like to echo and support very strongly what Chancellor Deaton just said about the University of Missouri being an ideal institution for the Coulter Translational Partnerships. At MU, we are known for working across disciplines quite smoothly. In fact, often I say one of our greatest strengths here is that interdisciplinarity and the fact that faculty work across all these many different schools co-located at one place that the Chancellor mentioned. That gives us a huge advantage compared to many of our competitors. The point here is that the real value proposition that this and other programs bring forward are based upon the integration of all our missions here at a major research university, including research, teaching, service, and economic development. Together, they form the complete nexus that makes this possible. For example, research at our MU research reactor spans many different areas and provides more radioisotopes for human health than any other reactor in the United States. It works from dusk to dawn on producing over 1,000 shipments a year of radioisotopes to 14 different countries worldwide. And it works from dawn to dusk on hypothesis-driven fundamental research that's so important for so many things we do. We've also seen the MU Biodesign and Innovation Program success in bringing together recently graduated people in engineering, in business, and also in medicine, usually someone who's starting a surgical residency. And this group of professionals can often identify great new directions for us to take. In addition, the Mizzou Advantage One Health, One Medicine initiative is giving experts in human health from the School of Medicine, with their counterparts spread again collaboratively throughout the university, especially in comparative medicine and animal health, in the College of Veterinary Medicine, to address things such as new treatments for prostate cancer using our nanotechnology and, again, the unique skills of our reactor, and better treatments for joint injury using new techniques for preserving healthy tissue in cartilage transplants. Our Coulter program is another example of the strength of interdisciplinary collaborations at the University of Missouri. By combining the expertise of engineering and the medical faculty, again with the close support of comparative medicine and many other units, we can prepare discoveries for the next step in the innovation process, when industry can invest in them to create new technologies to save and improve the lives of patients. This sort of collaboration with the free market to create great opportunities in the public good is something that we're really quite efficient at here at the university, and the Coulter Translational Partnership is showing us how to do that all the better. So now it's my pleasure to introduce to you Dr. James Thompson, our Dean of Engineering, to tell us more about how the College of Engineering's role in research and discovery assists so much in the exciting announcement today. Dean Thompson.
Well, it's good to be here. First, just as a general comment, I see so many partners in the room. And this is one of the, I've been at several universities, actually a number of universities. This is the best university with regard to interdisciplinary research and actually interdisciplinary teaching. It is also, many of these programs that you will hear about today, is an example of what I think the future will be. We have so many people, 320 million people living in our country. And each one of these people now, physicians have an array of not 10 things that they can measure and do for these people, but hundreds, if not thousands. So the complexity of understanding and then doing something from a medical point of view to human beings has become very extensive and very complicated. I think technology, certainly I'm so happy that you're going to be able to produce more physicians in Missouri, but that's not nearly enough. So to assist physicians, technology is required, and that's something that we believe very much in engineering. I'll go to my prepared remarks now. In our modern and populous society, engineering is very important to medicine. Modern medical procedures and devices have been created due to the partnership between engineering and medicine. Examples range from electronic health records, which we're very good at this university, better suture materials, which I'm looking at somebody that does things like that, to more complicated things like MRI, image processing, genomics. So from very applied to actually something that might not be applied for another 10 years. The Coulter Foundation program provides funding and a recipe for success for establishing the necessary partnerships, developing technologies, developing commercialization, and delivering improved medical care for patients. Wallace Coulter was an inventor, an entrepreneur, and a visionary. Mr. Coulter was the founder and chair of the Coulter Corporation, a worldwide medical diagnostic company headquartered in Miami, Florida. His passion for applying engineering knowledge to scientific research led him to invent the Coulter principle and the Coulter counter technology. This Coulter principle is a method for counting and sizing microscopic particles suspended in fluid, an engineering approach. By applying this technology to counting white blood cells, he helped to improve patient care and create the field of hematology, the science of the study of blood. Coulter launched an amazing career in biomedical engineering from a laboratory in his garage. I should add that Mr. Coulter did have ties to Missouri. He was a freshman at Westminster and ultimately got an honorary degree from Westminster. I might add, also gave a considerable sum of money to Westminster. But he had ties to Missouri. Thanks to the Coulter Foundation, the scientists we are recognizing here today have additional financial resources to further their discoveries. They also, which may be more important, be coached by the foundation and their leadership on how you commercialize, how you take a concept that has been developed by these engineering and physician teams, how do you commercialize it, and how do you get it to the bedside as quickly as possible. As an engineer, I think Mr. Coulter would be impressed today to see the innovation having developed here within EMU by the School of Medicine and the College of Engineering, based on many sophisticated technologies. I believe that he would be even more impressed by the collaboration of engineers and physicians to develop new technologies for complex problems. To announce this year's grant awardees and tell you a bit about their projects. And now I want to introduce Dr. Les Hall, Interim Dean of the School of Medicine.
Thank you, Dean Thompson. Jim, I was just reflecting as you were talking about collaboration when we first sat down and talked together about collaboration about a year ago. You articulated the vision then that the School of Medicine, School of Engineering, working together with the other schools, was one of the hallmarks of success of this campus, and nothing epitomizes that concept better in my mind than the Coulter program. And so we're very excited to be part of this today. As a physician, I've spent much of my career treating disease and caring for people, and so I know firsthand how important innovation is. I'll date myself here for a moment. The first year in medical school, we were shown these very hazy images from a new machine called a CT scan, which for the first time allowed imaging of the brain without things like injecting air into people's nervous systems. That was long before the first medical MRI images were produced. Coronary angioplasty at that point in time was considered a new and potentially reckless procedure for dealing with coronary atherosclerosis. Within a working life, things can change very quickly because of very important medical innovations. Some of the innovations we're talking about today are going to prove very, very important in the care that our patients receive tomorrow. So it's really an honor for me to have a chance to recognize and announce this year's Coulter Translational Partnership Program Grant Awards. Each of the research teams has 2 members, a clinician from the MU School of Medicine and a researcher from the MU College of Engineering. To be selected, each of these teams had to go through a very rigorous selection process that included review by a committee that included entrepreneurs, researchers, venture capitalist investors, and other experts. They chose research projects that had both great scientific potential, but also those that met a very well-defined clinical need. We really believe that each one of these projects will, in time, benefit patients in a very real and practical way. So I'm going to introduce the teams to you, and with each introduction, I will first list the faculty member from the College of Engineering, from the School of Medicine, and then second, we'll mention the faculty member from the College of Engineering, and I would ask that each team stand to be recognized as I read your names. The first team's members are Dr. Raja Gopaldus and Dr. Sharif El-Ghazawi. And Raja, you can raise your hand in the back there. This team is creating a device to reduce a patient's risk of stroke during minimally invasive transcatheter surgery. The device will filter blood flowing from the patient's brain while surgeons replace the aortic valve. The second team's members are Dr. Matthew Smith and Dr. Ferris Pfeiffer. They're developing a technique for repairing severe rotator cuff surgery injuries through minimally invasive arthroscopic surgery. The procedure uses a transplant of replacement bone and tendon tissue. The third team's members are Dr. James Stannard and Dr. Ferris Pfeiffer. They're working on a project to improve the success rates of cartilage transplants for patients with certain types of diseased joints. Dr. Stannard and Pfeiffer believe they can increase the amount of living tissue that survives a surgical procedure by modifying the shape of the transplanted portion of the cartilage. The fourth team's members are Dr. Gerald Arthur and Dr. Raghu Kannan. This team is using nanotechnology to detect whether colon and other cancers can be treated with specific therapies that target certain types of tumors. The fifth team is comprised of Dr. Richard White and Dr. Sheila Grant. They have developed patented technology for improving the success of anterior cruciate ligament reconstruction surgeries using nanomaterials to promote better healing. And the sixth team's members are Dr. John Pardalis and Dr. Shramik Sengupta. And I'm actually going to let you learn more about their work from our next speaker in just a moment. By funding these projects, our goal is to help researchers advance through the innovation process and develop procedures and devices that will benefit patients. To tell you more about that final step in delivering these discoveries to the patient bedside, I want to introduce Steve O'Connor, CEO of the healthcare technology startup firm Impedix Diagnostics. Steve.
Thanks. Thanks, Les. I don't actually have notes, so you can tell I'm not the academic. So if I mess anything up, help me. Just a quick background. I have a technical background. I'm not a tiger. Okay, sorry, but I'm not a jayhawk either. So I'm actually a beaver. So I have a technical background, and then I've been doing startup companies for about 20 years. So I've started about a dozen high-tech companies over the last 22 years, most of them in life sciences. I got involved in technologies here at Missouri through both Rebecca and Jake Halliday, who runs the incubator, about a year ago. So they brought me in to kind of like look at some different things that were going on. Again, mostly in life sciences, because again, that's my specialty. So I have a little different view than everyone else here, that I don't have a vested interest in the University of Missouri, other than I want to make money based on the technology you've developed. I met John and Shramik. We really got hardcore involved about February. In about June, we incorporated a company to license the technology. It's a very rapid bacterial testing detection technology. The primary clinical indication is sepsis, and I didn't know that much about sepsis before, but it kills more people than breast cancer and lung cancer combined. And it's really pretty, especially in children, it's really bad in children, and that's why John is involved as our pediatrician. And the sad thing about it is it's normally curable. If you figure it out soon enough, you can get people on targeted antibiotics, and they normally don't die. So, so what we're commercializing is a very rapid way of doing this. So the current standard of clinical care is about 1 to 3 days, and Shramik's invented a way where we can do it in somewhere between 3 and 12 hours. So so we're really excited about it. We actually got our first investment checks recently. We have additional money from the Coulter Foundation, which of course we're very grateful for. We're actually have an IRB file to start collecting clinical samples this fall, which I went to talk to John about afterwards, about yelling at the IRB to hurry up and get that approved. One of the interesting things I've found, I moved back to this region about 4 years ago. I grew up here. I live in Kansas City. I've worked with numerous universities over the years, licensing technologies, working with professors to develop them, et cetera. And so when I moved back here, it would be a lot more convenient for me to go to Lawrence, by the way. I only live 20 minutes from Lawrence, and I live about 2 hours from here. But there's an interesting culture here where like people like want to do stuff. And, you know, and at other places I found they don't. And licensing the technology here, I worked with Wayne, raise your hand, was the easiest license I've ever done, by the way. It wasn't the fastest, it wasn't fast, but it was the easy. And so every aspect of working with Mizzou has been really easy for me, and that's why I don't mind driving here 2 hours. The other thing I've found is people here really want help, meaning the professors I've interacted with are like pretty cool about, oh yeah, I don't know anything about commercializing, tell me what to do. And that doesn't always happen everywhere else. So it's been very pleasant. I don't know why, and I'm not going to pretend I know why, so whatever you guys have done, good job. But yeah, it's been really easy. It's been really smooth. We're actually conducting additional research in Schrammik's lab here, and it's been really easy to handle the administrative stuff, which is kind of weird at a state university also. I mean, normally if you're like at a little bitty school, that might be easy. But so anyway, kudos to you guys. The one other thing I'd like to say about the Coulter Foundation, this is really rare money. Like very rarely do you find money that can be granted to universities to kind of spend that extra $50,000 or $100,000 to prove stuff out with actual clinical samples or whatever you do, in a dog or a cat or a pig. And that's really the money, especially these days. It's a lot harder to raise money for startup companies now than it was 10 years ago. And so if you can just do that extra little bit of proof of concept work, so you guys are really lucky that you've got this money, I guess is my point, because this is rare money. It's very, you can't get this kind of money from the NIH. You can't get this kind of, you certainly can't get it from the NSF. So you guys are lucky. So thank you.
Thanks, Steve. I would like to congratulate once again all of our awardees today. I know I'm excited to work with you for the next year. Everyone here is looking forward to keeping up with the projects and seeing how they move towards commercialization and impact patients' lives. Also, I'd like to take this opportunity to thank Chancellor Deaton one more time for his support over the last few years. We know that in the next few months will be some changes, and we appreciate your support very much. And then with that, well, thank you. With that, that concludes the events today. We ask you, there's refreshments in the back, and there's also some tables around. Our PIs will stick around if you have any questions about particular projects, and enjoy the refreshments. Thank you.